We have 2 people online. We will just get started. Do we have a minute or two? Yeah, it's 4:30. So for the 2 people who are here, welcome. For the others, you can replay it, I'm sure. Okay. So before we get started, most of you know me. In case someone is watching this later and you come in from Tasween's profile, I am Simran Chopra. I'm a nutritionist and a deep health coach. And for the ones who will come in from, and if you already know me, then I'd like to introduce Dr. Tasween, because we have been dealing with so many women coming in with hormonal issues, fertility issues, and who better to talk to than a fertility specialist. Now, Dr. Tasween's qualifications are rather long, so I'm going to go through them very quickly. So you all know she's a DGO from Kasturba Medical College, Manipal. There's no way I can memorize this, it's really long. MRC OG, Fellowship in Reproductive Medicine, Fellowship in Minimal Access Surgery, Medical Doctor at Matrika's Fertility Center. We'll put a link to that as well. So, and it's also on my Instagram if you want to reach out to her for a consult later. She runs a state-of-the-art fertility center in Anandpur. She has over 8 years of experience in dealing with infertility specifically. She has authored more than multiple things in various fertility textbooks, and she aims to bring affordable fertility care to general public with a very natural approach. Now, I've known Tasween personally for a while. We interact a little bit. Yes, and I couldn't think of someone better who is better suited to talk to us from the medical side of things about fertility and sort of debunk. You're most welcome. And to try and debunk the sort of myths that many of us have. And I know that a lot of people don't actually go to a doctor when they have a slight problem. So here's your opportunity to put in your questions. And let's say we can't answer all of them today. Maybe we'll write them up and we'll email it to you. So maybe you can drop in your email or WhatsApp us your email. You can also reach Dr. Tasween at her clinic through Instagram. You'll find it on my Instagram, or if you come in through hers, you actually know her. Okay, so we are going to get started with I would like Dr. Tasween. The thing is that we find that when people come to us, and we work with over like 30,000 women, and most of them don't take fertility seriously till when they want to get pregnant. But by that time, that it could have so much damage could have been done. And we've been trying to create sort of education and awareness around this. So I wanted to basically ask you if it is, and why it is important for women of different age groups to sort of assess their overall well-being and understand their fertility and come to someone for a pre-counseling, even if they are not looking at getting pregnant.
Yes. So thanks, Simran. The key point here is even if you're not looking to get pregnant. See, that's very important. See, we get a lot of women, once they've been trying for multiple years, then they approach the doctor. So that might be a little too late at times. Not always, but yeah, at times. So why is it important is because, see, each human body is different. Every individual is different. One program will not fit all. That is very important when it comes to a medical field, very especially when it comes to fertility issues. See, one drug that might work for your friend might not work for you. So this is one place where friends may or may not be able to help you or may cause more damage. So it's best you go approach somebody, whether you are trying or not trying, just to, if you think that something is wrong, it's always best to go consult the proper people. If nothing is wrong, well and good, you can still sit at home. But if something is wrong, at least you have the opportunity to correct it at the right time before it becomes too late. That's very, very important.
Yeah. So leading on from there, what would be the sort of factors or markers that you would like to evaluate, or you would tell people to look out for so that they come to a gynecologist for that first assessment?
See, first and foremost, if you're planning a child, see, every couple, generally to speak, after you're married, whether it's after 1 year, 6 months, or after 20 years, you will look forward to having your own child. So what is very important is, first and foremost, is your age. If you are young, you still have time to wait. But if you're old, the ball is running very, very fast. So that is a very important thing, because in this 21st century where women are, more concentrating on their careers, delaying marriage, and, putting careers first, there is a high chance that, the fertility aspect of a woman is going down very fast. I'm not going to speak about, the environmental problems, the pollution and all, which again helps in all these, in increasing all this. But age is a very important thing that I look out for. Coming to the person as such, the BMI, the weight plays a very important role when you are looking at fertility issues. Not necessary fat, not necessary thin. Your BMI should be normal BMI. High BMI is not good. A low BMI is definitely also not good. See, there are a lot of misconceptions where, women are very much into exercise, into diets and all, where a lot of women are actually becoming anorexic. A lot of women are
So I'm not
actually,
sure. Yeah, we see this a lot, but we see it, when people do these crash diets more than anything else
yes,
without any sort of guidance. And,
yes,
when people going very, very low calorie and they land up with amenorrhea, we see it in athletes,
yes,
female athletes. Again, sort of when, when they're trying to wing it. Yeah, that's when we see it the most. When you look to Google for a diet and you've not sort of
yes,
taken care of sort of your hormones, because we see so many issues arising with hormones when
correct.
they've come to us after doing so many locality diets. So I don't know if you do this. We try to get people to track their
After
symptoms, and we
coming
get
to
them
you,
to
they'll
track.
end up with us
We try to encourage
and
people,
say, please help
so
me
that's what
now.
I yes, we try to encourage people to always go in for a pre-counseling, especially if they want to looking at getting pregnant. And I say, even if you're looking to get pregnant in 1.5 years, this is not like a Hindi movie, one time and it happens. So, you go in at least 1 year before, but we've actually been encouraging women to track their cycles very consistently in terms of, how long it is, what's the bleeding pattern like, and if there are issues, we tell them, why don't, it doesn't matter if you're 16 or 40, you just need to go see someone, right? Because
Yes,
diet plays, while it plays a very large role, like you were saying, when I had issues with my pregnancy, right, mine was, and I had multiple miscarriages, mine was low progesterone, and then after that they realized that my blood was clotting. So my medication was obviously very different from what maybe somebody else has, right? And
each patient
yeah.
should be individualized.
Yeah, so people right now, is there any, do you think that especially now with a lot of women sort of missing their periods, all the lifestyle issues, are there certain tests that you think that people should take?
Yes. So the main things that we would like to evaluate is, see. So the female, I will concentrate more on the female, not go into the male part right now. So when it comes to the female, there are three main things in the reproductive system that we actually look at. So let me see. Okay, can you see this to make life
Yes,
easier?
yes.
So this is the
Yeah.
uterus. So first things first is your uterus should be in the correct size, shape, position, place. That's very important. There should not be abnormal masses around, sticking around. Then, when it comes to the ovaries, the number of the follicles is important, and also the quality of the follicles or the oocytes that we say is important. Thirdly, there's a connection between your uterus and the ovaries. So, this connection should be open for the sperms to swim up and meet the eggs at the time of ovulation. And fourthly, what is another important thing is your hormonal parameters, as simple as thyroid, as simple as prolactin, or even vitamin D plays a very, very big role when you're considering your nutritional health and fertility health too, as a whole, I would say.
Yeah, I mean, you'd be surprised. Like while we tell people this, most people who come to us for fertility or having trouble with conception, they've been trying for months. They have not seen a gynecologist, and they don't even take the basics of folic acid. And so when people
Yes.
usually come to us, we're
A
like,
lot
if
of
you are not
people
taking,
actually listen to the neighborhood auntie.
that's exactly the problem.
Bajuwali
But then
auntie
when,
has told,
yeah,
no, don't worry, I had a normal pregnancy, nothing will happen. So they just
yeah.
sit at home. Although if a doctor has told them, people generally just like to listen what they like to listen, right? So
Yeah, but I think once you know
as
the
humans.
risks, like, so we usually are telling people you spend at least 3, 4 months making your body healthy, take the prenatals. If you haven't been
Yes.
taking folic acid, don't try to get pregnant immediately because, you land up with, if the baby lands up, God forbid, with chromosome defects, it's traumatic, I mean, it's quite
Yes, it's very, very
damaging for the
traumatic.
woman.
It's very traumatic.
Yeah, but how do you think age influences sort of a woman's health? Because what considerations should we keep in mind at different stages of our life? Because with women, it's not like men, right? There's this life cycle that exists. So, what do you think that we should sort of keep in mind to sort of keep our
So,
reproductive system in place?
uh, so it depends. See at which age you are. So now, if you're a teenager, maybe the best thing is to do, to keep your life, I mean, would say diet, nutrition, everything in place, so that when you step over to your reproductive life, like 25 to 35 is what we say is your reproductive life, you would be at a better stage than somebody who has just, not taken care of anything at all. So as we all know, PCOS is like the new hypertension, diabetes, obesity is skyrocketing. So it's
Yeah.
all a triad basically. PCOS, obesity, diabetes, everything comes hand in hand. Thyroid diseases. So if you have one, you're more likely to have the other. And there's a lot of misconception going around, at the era of Google where everything is just available at a click, people just want fast maneuvers. Nobody wants to work hard. So it's like, I can
I
cure, if
know.
somebody tells I can cure PCOS in 1 month, we all will, there's a line behind that person. But if you tell them the truth that, after all, PCOS is not curable, it only can be reduced, nobody wants to believe. So it's like, pick and
Yeah.
choose what you need. That's the first thing. Don't just, go behind somebody who's just giving some information. Make sure you authenticate your information. So at your reproductive age life, it's very important to make sure that you're actually ovulating if you're trying for a child. That's the basic most important thing. So the many tests that fertility experts or doctors do to see if you're ovulating, starting from maybe scans or even other blood tests. That's very important. Once you've crossed your reproductive age life, then menopausal, premenopausal, postmenopausal problems do affect some people at this point of time, because our lifestyle is very much different from what it was 10 years ago. Our mothers never had this lifestyle. So our
True,
lifestyle is
true.
more of a sedentary lifestyle where, it causes a toll on our health, basically. So that's very important. But if you're in your reproductive age group, it's very, very important to remember that, if as far as possible, if you're planning for a child, do not delay your childbearing. That's number one. If you're planning to delay it for whatever reason it may be, at least freeze your eggs so that you have eggs when you want it. So because every woman is born with a bag of eggs, I would say. So every month, one or two or three eggs
Yeah,
get
so true.
depleted.
So
So at
while you were
one
saying
point of
that,
time, everything will get over. And if at
yeah,
that point of time is when you want a child, you may not have your own genetic um, chromosomal child.
exact.
So that's
Agreed,
very,
agreed.
very
So
important.
I just saw two questions pop up. One was from a 13-year-old teenager, and she said she just got her periods and it's irregular. And the other is someone who had sent in a question to us, and that she's 35, and she's looking at getting pregnant, and is it too late, and should she even bother trying? So two very different life cycles of women. So if you want to take any of
So
those,
I would answer both. See, 13-year-old girl, see, you are having irregular menstrual cycles. If it's your first or second, or you have just attained menarche the past 6 months, it's very common for your first few cycles to become irregular. Do not get so worked up by it. But if you're already obese, or if you have a family history of diabetes, fertility issues in your family, or PCOS in your mother or in your sister, then maybe you would want to take things a little in your hands. Start at least with diet, not diet, I mean, not crash diets, a proper nutrition diet. Or exercise is the basic thing that you can start with. Usually, with a good exercise, with food control, a balanced diet, usually your hormonal levels will be set to
yeah.
normal. If it still doesn't, then please contact your gynecologist to rule out any other
Yes.
problems.
Yeah,
35
so
year old women.
I'm so I'm so glad you said it, because we keep saying it that that the doctor works hand in hand with your nutrition, because you go
Yes.
to them once, but then what you're doing every single day matters so much, and people just
Yes.
don't seem to think it matters at all. And no matter how
No.
much we say it, so it's great hearing it from you as well.
So 35-year-old women, you are not too late. There are many women elder than you who are still trying for a pregnancy. But definitely, if you have been married for, more than a month, more than a year, more than a year, and if you've been trying actively, regularly, maybe it's wise to visit your doctor to rule out any other problems. See, there may not be problems with you alone, there may be problems with your.
Exactly.
Evaluate one partner, think the other.
Yeah.
Grooming doesn't work. So you are
Yes.
still not too late, but definitely you should not delay it anymore.
Okay. And so, do you think that there are any natural or sort of alternative approaches that can be used to improve hormonal and reproductive health? So, let's say it's not when they straight away want to come to you. So, obviously, we say diet and lifestyle, but we are gonna hear it from you as well, because not everybody needs that medication, but they do need to fix certain things.
Yes. So, see, natural approaches, definitely I advocate for that. There's no way that, as a doctor myself, as a fertility expert myself, I do not believe that drugs cure everything. There is some effort needed from your end to cure some things in your body, because, see, you are the best judge for your body. You cannot expect somebody else to judge for you almost all the time. So definitely lifestyle changes is the main crux of it. The natural ways are definitely somehow or the other going to fall back on the lifestyle modifications. That includes diet, exercise, decreasing your stress levels, if possible decreasing your environmental toxins. And see, these are the cheapest ways. It doesn't cost anything. It really doesn't cost anything
Yeah,
compared to
true.
drugs, compared to your treatments. It's so sustainable. See, once it falls as a habit, it becomes life. See, for somebody who's,
True. I
doing it
agree.
every day, I think it just becomes part of you, and you don't have to go, to very difficult things. Sometimes I end up telling my patients that don't go for such hi-fi things. Just start with maybe 5,000 steps per day. That's enough. If you're doing 2,000, fine. This week you do 3,000. So as little as that, it makes a
Sounds like
difference
us.
rather than doing nothing at all. See, reaching
Yeah, of
10,000 for
course.
somebody with who's obese, with knee issues and all this, it becomes difficult. So let's start with something
I mean,
sustainable.
yes, completely. So we talk about, starting off really small and building up. So even if you have knee issues, it's only aggravated by weight, right? So then you find alternative ways to do this.
Yeah.
Because what we see usually is people say, "Oh, I have a knee issue, so I can't do this." No, but the answer is, "I understand you have a knee issue, so what can we do?" It's not about what
Yes.
we can't do. We know that. So why
Yes.
dwell on that,
See,
right? It's
that's
about
very,
what we
see,
can
when
do.
there's a way, there's a will, is what I say.
Completely, always. So
If you
I just saw
want to
another
do it, you'll
question
do
pop
it.
up from
Even
some.
if I say stand upside down and walk, you'll do it.
Yes,
So
agreed.
when they come
So I
to
saw this
us,
other
sometimes
question.
they are at that stage where, you tell me whatever you want me to do, I will do it now, but please give me a
Yes.
child. But sometimes, what happens is at that point of
That
time,
stage is too late or it's too
yes.
hard.
So it's already too late
Yeah.
where, there's little that we can do at our end also. Rather, probably started a
Yeah. So
little
I think what you're
earlier.
saying is, yeah. So what you're saying is to be more proactive than reactive. Like, don't wait till the
Yes.
problem comes up, look at it before. So, like, there's
Mm-hmm.
this lady who's 40 years old, and I just saw she put in a comment saying she gets regular periods, but how should she know she is ovulating? So, we do ovulation tracking on some of the programs that people wanted. We look for symptoms, basal temperature, all that. But I'll let you also take it, because that was her
Yeah.
question. She's
So
40 with regular
to
periods.
40 with regular periods, yeah, you may or may not be ovulating. So you can do all the tests that are available, like, basal body temperature, or, mucus gets thickened at a particular time of your periods, and all that would suggest that you may be ovulating. But the ideal indicator is probably you can get a follicular scan and track your ovulation and the follicle size and the follicle growth to see if the follicle is ovulating or not. So that's like the um, definitive indicator that you're ovulating, definitely.
Okay, awesome. So I wanted to ask you now, see, when there is so many tests, there's so much that women need to do, but how can they access, and I mean, quality healthcare without being like a huge financial strain? And again, I'm going to say quality because I'd like you to pitch in there also. rather than going to auntie
Yeah.
neighborhood at once.
So it's very, very important. See, now everything is available in Google. So thanks to Google, that, half of our work, I don't know if it's made things worse or good, but, one thing is pick and choose because there's so much of data available. So pick and choose the right people. See, don't fall for cheap, quick stunts. Not always, cheap is the best or most expensive is always good. It doesn't hold good when it comes to medicine. Okay. Or if a doctor, because there are 100 people visiting the person, it is a good person or a bad person. See what suits you. That is important. After you have tried actually working on yourself, it's still not happening, then probably you need some help. See, for an example, if you have a heart problem, you will go to a cardiologist, right? But I don't know why women who have fertility problem end up with their bajuwali auntie or their family doctor or a gynecologist or some other branch which is totally not related at all, and they waste so much of money, so much of time, so much of energy, so much of mental stress. They actually go depressed, and somehow when they reach a fertility specialist who can help them, they're drained out in all ways. So don't let that happen. Take correct treatment, take proper care at the proper time is very important. Not always it is expensive. Maybe, yes, maybe your baseline test to decide what is wrong with you is needed, which, some women think it is not needed. So if a doctor is going to write a 5 6 test at the start of time, you, oh no, this is an expensive doctor. But try to understand the doctor is asking for it, maybe to understand what is wrong with you in the first place. But some women, they just want a prescription. Just give me drugs. I'm happy with that. It doesn't always happen like that because looking at the person,
Yeah,
there's
so
little
that
that you
doesn't
can judge.
usually.
There's
Mhm.
little you can judge by looking at the person. The person may be all looking fine, but inside it's a havoc. So you really don't know. So that's very, very important. Because I've seen some women, 10, 12 years, they would have been just taking tablets, but not even one report will be there other than an ultrasound scan. So what will you judge? Which hormonal parameter you would judge? See, to put it simply, see, there's a light bulb. The light is not working. Now we need to know whether the switch is not working, the bulb is gone, or the wire is not working. I can't just be changing the bulb, like, giving you medicines and saying the bulb will work. So either the wire, I have to fix the problem, right? So I have to see whether the wire is not working, the switch is not working, or the bulb is not working. I just can't be changing the bulb,
True,
telling
true.
you that, this is the cheapest option. It doesn't always work that way. It may work that way sometimes, but not always. So that's when, fertility is quite affordable nowadays.
Completely.
Even IVF cycles are pretty much affordable. And not everyone advises you an IVF cycle. That's the last end hope for any person. But if you've been married for like, 20 years, you're already aged of 40, then definitely your doctor is going to advise you IVF at the first go because you have less
Sure.
time in hand. Definitely. So
Mhm.
if your hormonal
Okay.
parameters or if your parameters are definitely way out of hand, then, we otherwise most fertility issues, most would be solved. Your location, that is very, very, very important more than drugs.
Yes, true, true. I mean, we recommend at least giving yourself 3 to 4 months before trying to conceive,
Yes,
like giving your
minimum.
body enough
See,
time.
body takes
Yeah,
around 2 to 3 months to see any change. You cannot expect a change
correct.
overnight. That's not going to happen, even with any drugs, anything, for that matter of fact.
I think people right now don't see the connection between, they think that, it's time to get pregnant, abhi time hai, it's right time to have a baby, but they don't see the connection between a healthy body equal healthy pregnancy equal healthy baby.
Yes,
This sort of connection seems to have been lost, and they don't, ideally, you should be, people spend more time losing the postpartum baby weight than they spend pre conception. And the
yes,
time that you spend pre-conception is actually way more important, because it's multiple things and factors that we have to take in, right?
correct.
So I think, yeah. So, but in terms of, are there any sort of preventive measures or screenings that you think women should consider for just maintaining and monitoring their health?
Maintaining and monitoring your health screening tests would include a pap smear is very important, I would say. because India is the cervical cancer capital at present. So pap smear once every 3 years. And if you're over the age of 40, maybe you would want to get a USG of your breast or mammogram done to just, make sure that you're not, basically cancer screening is very, very important, is one preventive test that you would like to do as a woman as a whole. That's the main thing.
True, true. In fact, I did this recently as well. I keep doing them every year, a year and a half. Maybe I'm going to send them to you just in case to check.
Sure. No problem.
But yeah, but
Anytime.
that's the thing, that this is where the expense comes in. But something that I think we need to help people understand is this whole prevention is better than cure, proactive,
Cure,
right?
yes.
Because while these tests might be expensive, they might save your life, literally. And
See, it's like spending
worst case,
1,000 rupees now and spending lakhs for your treatment.
lakhs and lakhs, but then and also survival rate, right? There's a big difference.
Yes.
Nobody wants to deal with cancer, and in stage one, it's easy to, in most
It's
cases at least. But
traumatizing, in fact,
catching,
also.
yes, yes, but catching anything early, whether it is an hormonal imbalance, whether you have, I keep saying this, that if you see that there's something off about the way your body is behaving, periods are irregular, you're getting some weird acne you don't understand, or you're feeling really sick, or you're like, if you see symptoms that are not normal and you're like, why is this happening to me? That's when you just go and tell a doctor and say, hey, is something off? Because the body is usually saying something, right?
Yep.
But I don't know, people seem to have come to become scared of doctors. Like, for example, you said vitamin D, and we make everyone check vitamin D, okay, B12, vitamin D, iron. And when it's low, they're like, what can we take in food to take it? And I'm like, your vitamin D is 6. Like this, you need like an injection, like right now. You don't need food, right? But they don't get sort of the severity or how dangerous it is to leave it that low. It's
Yes.
okay to maintain at a certain point, it's okay to maintain with food and lifestyle, etc. But when you
Mhm.
are at that rock bottom, you need a doctor to pull you out. That's what modern medicine is about, right? But people don't seem to pick this up. Yeah, so but do you sort of also look at sort of the role of nutrition, dietary considerations while supporting sort of overall health and well-being? Because um, it depends, Dr. Ab, that is exactly what we do, but I just want your views on
Yes.
it, or
I think
to see
it's
how
very,
it sort of
very
merges
important.
with the two. Hmm.
Yes, it is very, very important at any point of, any stage of life, in fact, that, because there is so much of fit fat diets. Forget about diets. See, for an example, there are some diets that say just drink certain juices every day. How will a juice give you protein is my concern. See, the whole idea of a balanced plate that contains carbohydrate, proteins, your fibers, your fats for that matter, or even your micronutrients. There's a role of every single thing in the plate. That is why it's called a balanced diet in the first place. So people need to understand that, this fit fat diets just do not hold a role. You are either making your body become worse, not helping you. You may lose 5 kgs in 1 week, but once you stop those juices, you will gain 15 kgs like that. But people
But do
refuse
you
to.
do you see the connection between like the people that come to you? So we see
Mhm.
multiple things going wrong, but as a doctor,
A
do
lot,
you see actual damage that has happened to
a
their
lot,
health
a
because of
lot.
doing these
Because
crazy things?
after all these things, what happens is your whole hormonal system gets screwed up. Basically, everything goes haywire because your body needs a certain level of every nutrient to function. That's very, very
Hmm.
important. Water, whether be it as simple as water. So your body
Hmm.
needs a certain level to function. Every cell needs water to stay hydrated. That's very important. But, or for that matter, even protein. Some people complain that they have hair fall, but it can be just as simple as having protein deficiency. That is why your
Yes,
hair is falling every day.
I am screaming this from the mountaintops all the time. Nobody wants
Because
to
see, our
listen,
Indian
because I think
diet
nowadays
is,
people want to think that there's a bigger problem, but sometimes it's the
uh
simplest thing that
it's
you need to
as
fix.
simple as
So
that. So it's very, very important. Like a lot of women think that, their hair is falling postpartum, or, I've changed my water. I don't understand this change of water. It's just as simple as protein sometimes. So, especially the South Indian diet is very, very much deficient in protein. There's a very high
Yeah.
carbohydrate intake, but a very less fiber and a very less protein intake. So, as simple as correcting that will correct a lot of hormonal imbalances. That's one thing. The second thing that is very important is, because a lot of women live in the metros, get carried away with the Western culture where smoking, alcohol is very much rampant. So
Okay.
smoking, whichever way, I have women
Yes.
coming to me and saying, I don't smoke
Please
cigarettes,
cover
but
vape
I
also
just
now.
take
Please,
hookah.
please cover.
I just
And
take
vape, the
hookah.
new.
So any form of cigarette, any form of smoking is smoking. It is bad for you. Okay, whatever it is, please don't say it is hookah and it is not carcinogenic. It is carcinogenic. Whatever form of smoking is smoking. See, if you tell me to compare smoking and alcohol, I will tell you, please drink, but don't smoke. If you say, doctor, you let me do one thing, either smoking of alcohol or alcohol, I would say, you please drink, you don't smoke. Because smoking is known to have so much more bad effects compared to alcohol. Both are bad, but yeah, so alcohol in a moderation,
Okay.
occasionally social, it is still okay. But smoking any form, be it vaping, be it hookah, be it cigarettes, BD, whatever, and tobacco chewing, obviously. So if
True.
at any stage, at any point, I think it is best avoided, especially for a woman.
Okay. So there are some questions that have come in. I'm
Uh-huh.
just going to quickly call them out and we can try and answer
Yep.
as many as quickly as we can. One says, what if someone has had multiple miscarriages? What's the most important thing to look for?
Okay, multiple miscarriages. First and foremost, hormonal evaluation is important. See, there can be immunity problems, immunological problems. So you are more prone. Basically, the cause of miscarriage. You had the miscarriage, that's
Yeah.
also very important. If it's in the first 3 months, it's most likely a chromosomal problem. If it's later half, maybe it's an anomalous baby as such, or you may be having a cervical incompetency. So it depends. It's very difficult to answer in 2 lines of
It's
why
too
it's
many things. So
happening.
I think the answer is that
Yes,
you need to see a fertility
best
specialist.
consult a fertility specialist or your
Yeah, and I think one thing, I
gynecologist to
don't
go
think
further.
everyone does it. I would say is to, like, I know I do it, I have it for years now, is to maintain like this file, your medical file, and just keep filing every single thing
Yes,
in one place because
yes,
people lose stuff. And if you have five miscarriages, whether it's someone like me, a nutritionist, or if it is a gynecologist, they need to be able to see like a trajectory and a trend. And that's where we
yes,
find stuff. So if you have stuff missing, it makes it harder. So just like file
yes,
everything,
yes.
like child folder, father folder, mother folders,
Mother
everything. Just
folder,
file
yes.
everything,
Yes.
everything. Okay, so another
Every
one
small
here
paper
is,
is important. You never know what your doctor will need. So
yeah.
every small paper, just show it. It's okay if they don't need it. But yeah, just put it across.
Okay, so a lady has said, what steps to take when planning a baby? Any supplements to take before conceiving?
Folic acid, folic acid, folic acid, folic acid.
Yeah, and check your vitamin D for sure as well. But
Yeah.
yeah, so then I'm just going to go to the next one. What are the parameters to check in blood test reports if I'm planning to conceive? I'm 32.
Okay, parameters in blood test reports. Very simply, your hormonal profile. First and foremost, your HB, your hemogram, whether your blood, are you having any anemia? That's very important. Your sugars, your sugar profile, your fasting sugar, or your HbA1c. Coming to your hormonal parameters, thyroid, prolactin, AMH levels, FSH, LH, vitamin D is important, and also a tubal patency test will help you. And for your husband, definitely a semen analysis, blood and thyroid levels are important.
Yeah, and then don't try reading these tests on your own. Please show
Yes.
them to someone. Yeah, yeah,
Because
okay.
a lot of times the test
Okay,
tells you abnormal, and we actually may treat it as normal as well. So it all depends. So
yeah.
don't be your own doctor. There's a reason
Okay,
why
there's
we've
one
taken the
saying,
struggle.
yeah. So there is one that says, please tell me about high prolactin. I have no solution anywhere. I guess I think even before she answers, you'll have to tell her the value of high prolactin, how much it is. If you took it once or twice, so I think you need that as well, because high prolactin is subjective.
Yes. So high
Prolactin
prolactin is
can
going to be
vary.
very, very subjective. It depends how high you consider it as high. And
Hmm.
preferably, if you've taken your test in a fasting early in the morning, would be a more accurate result. But if your prolactin is very high, just say if it's more than 100, I would say that you consult somebody. You may need a CT scan of your brain to see if you have any prolactinomas to rule out that as well. And also, your thyroid parameters are very important when we're dealing with prolactin issues. So, both come hand in hand, actually. So, that's one very important thing. But if
Yeah.
it's very,
Okay.
very high, then please visit somebody to get it sorted. But if it's in the range of around 20 to 40, then maybe, it depends on food also. Actually, prolactin, there's a lot of,
Yeah.
your cabbage, cauliflower, all this, what it affects your thyroid. Sometimes it affects your prolactin levels as well. So if it's moderately high, then I think it should not be much of a problem.
Okay, so there's this one that says for someone who is 33 years old,
Mm-hmm.
BMI 23.5, has TSH, FH, and prolactin normal limits, USG
Mm-hmm.
normal, cycle regular every 28 days, but the flow has reduced. What to plan pregnancy? Wants to plan pregnancy? What to do?
First, start your lifestyle
Again, like she said,
modifications.
yeah, but obviously here HP is also not there.
Yeah.
But I think like Dr. Tasween already said, there are multiple other tests. So I think
Test
the solution here is to go and see why your flow has reduced.
reduced.
To
Yes,
do that, your best, yeah. So the best thing to do here is to go to a fertility specialist. I mean, you can reach out to her. You have online consults as well, right?
I do. I do.
Yeah, so y'all
Mm-hmm.
can maybe reach out, because here there could be multiple things. Like for example, like she just said, you've not tested prolactin here. If it's high, it could be
Yeah.
causing an issue. There's so many. I mean, the human body is very, very complex. That's why the people think you can read something on Google and apply it. It doesn't. There are so many interconnections, permutations, combinations,
Yes.
that it is insane.
Yes. Yes.
Like
Yes.
when we are building something, the number of things that you have to keep in mind, like it's not just macros. Okay, can she have these kusumas? Can she have that? What is the limit of fiber? What is,
Mm.
like, there's so much going on, and people think it's so simple. Jan, she told me ki bangan khane se ho jayega. What nahi
Mm.
hoga kuch bhi, right?
Yeah.
Then there's what to do. There is one who said, okay, let's take one last question. I think also, uh, how to take, we said that, how, what to do in case of very high prolactin over 100 with PCOS? Similar.
Please visit somebody.
Yeah. Yeah. So I think we've actually taken up nearly 40 minutes, which is pretty great.
Mm-hmm.
So anyway, I think what we will do is, as more questions come in, you can send them to us on Instagram. You can write them in the comments under this. You can email us or send it to us on WhatsApp. And we will also, for everyone who had sort of booked and who had booked, or had wanted to, we will send you Dr. Tasween's details. If you're in any of our programs, you can just ask your nutritionist. They'll send it to you. She does online consults as well. So does her team. So if you want to show her something, you're most welcome. And just one last question for you, Tasween. What advice would you give to women who may be concerned about their health and well-being? The most important advice that you could give someone.
See, it's how to give it in one line. It's very difficult. So maybe don't plan so
Just
much.
like this one core, yeah, one core
Yeah,
thing that you
don't
think
plan so
everybody
much.
needs to
Life is
know.
not a manual. So start with your lifestyle changes. That's very, very important, I would say. More than any drugs can help you. If you can change your lifestyle, that's going to be very important. If you are a woman who's planning your pregnancy, I would say, firstly, just try naturally. Don't make sex a chore. People rely so much on apps, so much on trackers that they just make it such a big chore. So don't do
Hmm.
that if you're trying for a pregnancy. And if you are already trying for a pregnancy for a lot of time now, probably more than a year or so, then it's best to consult somebody that's there. And if you do not still conceive, please seek proper help, not your neighborhood auntie. That's very important. And trust yourself, manifest in your pregnancy or your whatever health problems and all that. Seek the correct help. That's very important. And try doing it yourself, lifestyle, and don't follow fit fat diets. That's not going to help. Have a balanced diet. That's very important. Everything doesn't revolve around weight. Even if you're obese, if you're fit, I think it's okay. You should not be
Yeah,
thin and malnourished. That's also not okay. So it's
that's
very
exactly what you
important to
meant.
just
Be
be
fit,
normal.
be strong. Yeah,
Yeah,
be
it
fit,
just be
be strong. Don't
normal.
be
I mean,
slim and skinny and
yeah.
yeah. So there's this one girl, she's asked 2 times. I thought I missed it. If you can help her, I'm 22, have to control mild PCOS, have fibroids in my left breast, PMS before 7 days of getting period. What can I do? And there is Saranya. I don't even have her thing, but yeah, just that one, and we can close it.
Yeah. So I think we've told this also earlier that since
Same.
you have
Yeah.
PCOS, yeah. So it runs down
But they're
to
getting quite thing like, now answer my question. I think we have covered it, but still.
So yeah, I mean, so PCOS, see, it's a lifestyle. PCOS is more of a lifestyle disease, I would say. It's not a hormone. I don't want to classify it as a hormonal problem anymore. I would say it's a lifestyle disorder, because
Hmm.
so many women
Yeah,
are
and
suffering
one,
from PCOS. It's a lifestyle disorder.
yeah,
It's see, there is
completely.
a point of hereditary see, if your mother would have had PCOS, yes, you are more prone to having PCOS. There's a hereditary component to it. There's a genetic component to it, but more so, it's a lifestyle disorder. I feel it's because of the sedentary lifestyle that all these are cropping up even more. So first and foremost, set your lifestyle right. Have a balanced healthy diet, exercise at least 3 times a week, and make sure your hormonal parameters are in normal. For your fibroadenomas in your breast, it depends on the size. If it's too big, you may want to get it removed. With your lifestyle modifications, your PMS symptoms also may disappear. You may want to take vitamin E supplements to decrease your PMS, but also get your vitamin D levels and B12 levels checked. That's also quite
Yeah,
important when
keep
it
saying
comes
it.
to
No one
PMS.
does it. Yeah, so I think Saranya, that answers your question as well. There's only one more which says her left breast is bigger than her right one. Is this a problem?
No, it's not a problem. It happens with a lot of people.
Exactly.
Please don't be
Yeah, the
paranoid.
human body
It's
actually,
it's
we are
totally
hands, legs,
okay.
nothing
It's
is the
totally
same.
okay. Some people have one arm
Yeah,
bigger than the other arm, or one thigh bigger than the other thigh.
correct.
It's totally okay.
Yeah,
It's
yeah,
totally okay. You are not a box piece.
yeah,
So it's okay. Don't
yeah,
worry about it.
completely.
Don't break your head about it.
Awesome. Thank you so much. We've actually extended a
Mhm.
little bit more, but
Yes.
thank you so much for being here, answering these questions. For anyone who
Welcome,
has more
welcome.
questions, send us a WhatsApp. We will send you her details
Mm-hmm.
if you want her details. Otherwise, we were thinking that, people send in questions, maybe we'll send it to you, we'll answer it and email it back to
Sure,
them,
sure,
making it simpler with your
sure,
details
definitely.
as well. So if you want that, you want her to answer questions, you can reach out to her directly. You can send it to us on WhatsApp. We will put it into an email, get a reply, and send it back to you or whatever. Yeah, but thank you so much for joining us. It's amazing.
Welcome.
I'm hoping to
Thank you
see you
so
next time
much.
you're in Bangalore. Yeah,
Yes,
thank you so
definitely.
much. Okay,
Yes.
thank you.
See
Bye.
you
Bye.
soon. Yes. Bye bye.